Hello and welcome to College Week Live with Miami Dade. I'm Erica Redmond, Director of Recruitment for the medical campus of Miami Dade College, and I'm here today to talk with you about the many programs in the medical field that we offer at the college. First of all, let me thank you for joining us. It is definitely my pleasure to be with you, and as we go through the presentation, please feel free to ask as many questions as you have. I'll try to answer them. And those that I don't answer during the presentation, just know that we will be on the live chat at the same site until 7 p.m. tonight. So if I don't get in all of your questions, please, after the presentation, just email the chat in the chat room and we'll answer your questions there. All right, let's get started. As you can see, there's a PowerPoint along with this presentation so you can follow along. And I will try to go through all of the programs that we have. One of the biggest things is healthcare is such a growing industry, and there are so many options available to students that they don't even know about. So my purpose here today is to inform you and to let you know that there are so many programs that we offer, and also it's such a growing industry that there are always positions and jobs available to you, whether it be in South Florida or leaving the area once you've gained the expertise. So let's begin the presentation, and we'll first look at our campus is divided into two areas, the School of Health Sciences and the School of Nursing. We're going to talk about the School of Health Sciences first, and with our short-term certificate programs. Now these are for the students who want entry-level job or need to get certified in certain areas so that they can go out into the work industry. It provides them with the knowledge and the guidance that they need in order to function in those positions. So let's start out with our first one, which is phlebotomy. And as you can see, phlebotomy is one of our short-term, really short-term programs. It's only one semester. And that person simply is the person who draws blood. They can work in a hospital laboratory, they can do blood banks, or any other healthcare facilities to collect blood for testing. That is a one-semester program. And then we have our emergency medical technician. That coupled with the paramedic program, a lot of students will do the EMT first, which is a one-semester program. Now that person can work in an emergency room, they can work in clinics, or they can work on the ambulance. So it just depends. It's mostly pre-hospital type work that they do. Once that person goes through the one semester in the emergency medical technician program, they have the option to go into the paramedic program, which would be an additional year. At that point, because there are levels, that person would be certified as an EMT and also as a paramedic. And some students will choose to continue on and become firefighters. We have our fire academy at the North Campus of Miami-Dade College. So as I said, it goes in levels. You could do EMT, then paramedic, and from there go to the fire academy. Or for each of the individual ones, you can get employment in any of those areas. So that's a great thing for students as a starting point, because a lot of times students need to get out and work in the industry and start making income. And this is a viable way for you to do so and also be in an area that you desire. Our health informatics specialist. Now that's a program that is brand new to us, and because a lot of the hospitals and healthcare facilities are moving away from the pen and paper and they're going more to the electronic records. And this is what that person would do. They would basically be in there to train and assist in guiding those people towards using the electronic record system. So that's a very viable job right now. And as you can see, it's 2 semesters, and those students are starting out after only 2 semesters with salaries of $33,000 and up. So it's a very lucrative area for students to get started in. Another one of our programs is the massage therapy, and that's a 2-semester program as well. And of course, those individuals, once they complete the program, could work individually and just basically have their own clientele, or they can work in a spa, a hotel, or go on a cruise ship and work there. A lot of our massage therapy students may go on to become physical therapy assistants or even physical therapists. So that gives them avenues and experience as they go along, basically called completion points. Another one of our programs is the pharmacy technician. Now, the pharmacy technician, of course, is the one that would assist the pharmacist in areas and in places such as a CVS or Walgreens or Walmart's. They would help with the distribution and accounting under the supervision of a licensed pharmacist. We talked about the paramedic program. The medical assisting program, that is basically the person that works directly with the physicians in the business aspect, as well as the clinical functions of a medical office or a hospital. So that person really gets hands-on. And then our last of our short-term certificates is the medical coder biller. That's the person that translates the diagnoses and procedures into the numerical coding, also dealing with the insurance information and that type of thing. So once again, the medical assistant and medical coder biller both are 1 year in length, and it gets the person out and gets them started. So it just gives them avenues. And as I said, there are so many completion points. Going back to the paramedic, if a person goes from the EMT to the paramedic and say that they don't want to go into the fire academy, they want to continue their education, for instance, in nursing, then that student could go from the 1 year paramedic program into our 1 year bridge nursing program, and at the end of that 1 year become a registered nurse as well as a paramedic. So it's a great opportunity for students to explore different avenues in the healthcare industry. So now, with these short-term certificate programs, how do you get started? Well, a student would basically have to graduate from high school, either with their standardized diploma, or they could get their GED. Either of the two, Miami-Dade College will accept. After that, they would take an entry-level test, which is called the TABE test. That, coupled with an Introduction to Healthcare course, will allow the student to apply to any of those programs that I just talked about in short term. Now, there are deadline dates for the applications for these programs, but we're somewhat lenient with that. We will accept up until the classes are full. So even if it goes beyond the deadline date for these short-term certificates, we will continue on accepting applications until we have our class. Now, of course, all of these programs are limited access, which means we're only going to take a certain number of students each semester. So you need to be aware of all of the criteria, and everything that I've just gone over is also on our website at www.mdc.edu/medical. So all of this information is there, or you're definitely welcome to come in to speak with an advisor to make sure that you're taking the appropriate coursework in order to complete prerequisites and your application in order to go through the program. Okay? Now, also in the School of Nursing is what is called an Associate of Science degree. Now, this is a degree that allows the student to not only get in class lecture and procedures, but also to provide them with clinical and laboratory training. This allows the student at the completion of the program to sit for their state board, to be licensed in that area, and have the ability to go to work. It doesn't mean that the student stops going to school. It just simply means that that student will have a license and have the option to go to work or continue their education or do both. And 90% of our students do both. They get out into the field to start to get the experience that they need while they're continuing their education with their bachelor's degree, master's, or doctorate. So it just allows you to have that beginning point. And as you can see in the School of Health Sciences, for the Associate in Science degree programs, we have a variety of programs. The Clinical Laboratory Sciences, the Dental Hygiene, Diagnostic Medical Sonography, and Emergency Medical Sciences. Now, your Clinical Laboratory Sciences are obviously those students that work in the lab. They have very little patient contact because some people want to work in healthcare but not necessarily have the bedside or that patient-to-patient contact, but they want to work in the field, and this is a great way to do it. This one, along with the Diagnostic Medical Sonography and the Dental Hygiene, once again, they give you training in those areas so that you can go out and apply for those types of jobs. Now, our dental hygiene students, they of course would assist the dentist, and they can do your x-rays, your teeth cleaning, the full examination, your pre-examination prior to when the dentist comes in. Diagnostic medical sonography is simply ultrasound. A lot of people relate that back to when a female is pregnant. The ultrasound basically determines the sex of the baby, whether it be male or female. That's one aspect of it, but there's so many other areas related to the diagnostic medical sonography. The EMS program is a combination of the things I just talked about, with the EMT and the paramedic coupled with prerequisites. That student could receive their associate in science degree in emergency medical services. Other programs are the health information management, the histologic technology, nuclear medicine, and the vision care program. The health information management, once again, is dealing with the records and the paperwork aspect of healthcare. And that is a vital area that students need to understand. Is all of that is your preliminary work, all of your health information, all of that is on record, so that when the physician sees you, they have that chart in front of them with all of the pertinent information to make the valid diagnosis. The histologic technology is a student would be working in the lab as well. That is related sometimes to CSI. They're dealing with cells and tissues and trying to figure out what are the causes of certain types of diseases or anything of that nature. So they are doing most of the laboratory work that goes on to the physician. Nuclear medicine is another area. That's more of your imaging. That's a person that is run through an imaging machine under the umbrella of radiography, which is the x-rays. So all of that is basically to see what is happening within you with all of your imaging and taking the x-rays. Vision care is dealing with your eyes, of course. They can give the examination as well as preparing prescriptions for whether you need contact lenses or glasses, or if there is something going on medically dealing with your eyesight. From there, we have the physical therapy assistant, the physician assistant, radiography, respiratory, and veterinarian technology. The physical therapy assistant is the one that would assist a physical therapist. Now, students will sometimes ask, I want to be a physical therapist, why should I become a physical therapy assistant? And basically what happens is a student going through this physical therapy assistant program will gain the experience and knowledge necessary to get out and start working under the supervision of a physical therapist. So it will give you that experience that you need, especially as you go on to get your bachelor's degree and your master's and doctorate for your physical therapist. They will be looking for those students or those people who already have experience in the field. So this is a prime way for you to get the experience that you need in order to go on. And then some people just simply want to be the physical therapy assistant. And as you can see, that's a 5-semester program, and starting salary roughly around $45,000 to $50,000 a year. So it's a very good way to get into the industry. The physician assistant is just that. That's the person that assists the physician. They can see their own patients, write some of their own prescriptions, but they are under the supervision of a physician. Radiography, once again, that's the umbrella I was just speaking of, which is your x-rays. That's the person that does all of the x-rays. And as you know, most patients coming through, if they need, they have a broken bone or potential, they would go through a radiographer just to get those x-rays. Respiratory therapy, of course, is dealing with your breathing if a person has asthma or anything of that nature. And then, of course, veterinarian technology. Yes, we do have animals on campus. Sometimes it kind of surprises me, but they are around. And that, too, is an industry that most people who are animal lovers or love the care of those will go into our veterinarian technology program. Some of them will eventually go on to become veterinarians. So they're all relevant to you moving up the ladder. And this is just your beginning point. Now, for all of these programs that I just talked about, from the clinical laboratory sciences on down to the veterinary technology, those associate in science degree programs require that a student, first of all, graduate again from high school with their standard high school diploma or GED. From there, they would have to do what is called prerequisite courses. Those are courses required in order for the student to apply to any of these programs. And you can find that information by coming in to see an advisor, or you can go on our website and we have a listing of all prerequisite courses. And just to give you an example, prerequisite courses could include your sciences, your anatomy, chemistry, or microbiology, as well as your core courses, your English, your math, speech, critical thinking. Just to give you an idea, each of the programs have their own set of prerequisites, but there's a great deal of overlapping. And the benefit of that is, say for instance that the student is not really sure of what program they want to go into, by taking those prerequisites, they know that most of them will apply to any of the programs that they're going to apply to. Especially if the programs are very similar, the student may want to apply to both of them, and depending on which one they get accepted to, they will go in that direction, but they would already have the prerequisites completed. Each of these programs also have a deadline date, so please make sure that you follow that as well. And that simply means that there's a certain time during each semester that applications are due for that following semester for students to get accepted into the program. Most of our programs, prerequisites are required to be completed prior to the application being submitted. So make sure that your timing is right. And once again, by you coming in to speak with an advisor, will tell you what you need to do in order to meet those deadlines. Okay? Now we're going to continue on. We have, as well as the Associate of Science in the School of Health Sciences, we have a bachelor's program. That bachelor's is connected to our physician assistant. Now, as I said, under the Associate in Science, the physician assistant program, which is a 2-year program, not counting prerequisites in program courses. Once the student completes that, they sit for their state board to be licensed as a certified physician assistant. At that point, they're eligible to apply to the bachelor's degree in the physician assistant. And that's basically another 1.5 years that they would have to complete. And at that point, not only would they have their license as a physician assistant, but they would also have their bachelor's degree. And from there, of course, they can continue on with their master's and doctorate at a higher level institution. Now let's look at our School of Nursing. School of Nursing has the Associate of Science as well as a bachelor's degree. Now the Associate in Science degree has 3 tracks: the generic track, the bridge, and accelerated. Now the generic is for those students coming directly out of high school. They do not have any nursing experience or healthcare experience. They're just graduating from high school. Then they can come through our generic program by first, again, doing prerequisite courses. There's also a test that they would need to take. Right now it's called the TEAS test. That's a part of the criteria for students to be accepted into the program. The TEAS along with the prerequisite courses. Starting after September 2013 deadline, that TEAS test will change. And of course, all of it will change to another test. The information for that test is already online. You can go to our website, look at nursing, and you'll see what the new test will be. And soon they'll have details on there. But right now, we're continuing to accept the TEAS scores for all of our tracks of nursing until September 2013. After that, we will change criteria. So I say that because I really want you to keep that in mind, because that's going to be a significant change for our students. So I want to make sure that everyone understands that. Our Nursing Bridge program is simply that it's a bridge. And as I spoke before about the paramedic, a student going through a one-year paramedic program, and then they can bridge into a one-year nursing program to become a registered nurse. Not only can a paramedic do that, but a licensed practical nurse, a registered medical assistant, respiratory therapist, and even military medic. So all of them can have that certification and apply to our nursing bridge for an additional year to become a registered nurse, along with already being certified in those areas. So what it does is it increases your status in the working industry, and it puts you in line for promotions and higher level positions by having both of those certifications. So just keep that in mind. Now, Nursing Accelerated is for the student that has gone through and received a bachelor's degree in any area. It could be business, could be journalism, could be accounting. They've received their bachelor's degree, but yet they want to come back to school and switch careers to nursing. They too would be allowed to come in for 1 year, an accelerated program, to become a registered nurse. So that's also, in other words, that's an additional field that that student would then gain and be able to work in that industry. Now, all of these programs, all of the nursing tracks require students to do prerequisites, the same as in the School of Health Sciences. Nursing requires that you do a set of prerequisite courses. Again, those include your sciences and your core courses, as well as I said, there's an exam that goes along with it. Right now it's called the TEAS, T-E-A-S. And after September of 2013, that is going to change. And right now, the way that we accept students into the program is their grade point average in those prerequisites, as well as their scores on the TEAS test. That is how students are accepted into the program. Now, people always ask, is there a waiting list? And I see one of the questions here right now is asking, how long is your waiting list? We do not have a waiting list. We have limited access, which means students, once they complete prerequisites by the deadline date, can submit to apply to any of these programs. If they're accepted, they start the program. If they're not accepted, they have the option to reapply. And they go back in the pool with everyone, and we start the process over again. So it's very important that as you are taking prerequisite courses, that you get the best grades possible. You avoid withdrawals and D's, obviously D's and F's, and even C's. The better your grades are, the better your chances are of getting into the program. So all of that is very important for students. I see another question here that asks, can we start directly at the medical campus? If you are going through a short-term program, which are the ones in the beginning, you can graduate from high school, as I said, take the TABE test and an introduction to healthcare, and apply directly to the medical campus. If you're accepted, you would start with us. Students who are going through the Associate of Science degree programs must start at any of our other campuses. They do their prerequisites on those campuses, and then they apply to the medical campus, and if accepted, at that point they would come to us. But they would not start directly with us. They would choose a campus, preferably to where you work or to where you live, and start taking your prerequisites. You still can come to us for your advisement, for any advice, but the actual courses have to be taken at those campuses. So make sure that you find out, and once again on our website gives you all of the locations of each of our Miami-Dade College campuses that you can attend. It's important that you follow the directions that are on our website and that the advice that our advisors give you, because that's critical. Even if you're a student that's transferring in prerequisite courses, you have to make sure that your transcript is in on time, making sure that, and we ask that it be in at least 3 months ahead of time. That allows for it to be evaluated properly, and the courses that you've taken already, that you be given credit for. And at that point, then we can tell you what additional courses, if any, you would still need to take prior to applying to the program. So it's important that you get all of that paperwork into us, that you follow the deadline dates. Now, unlike the certificate programs where we are lenient with accepting students up until certain points, with the degree programs, we try to stick with those deadline dates. Actually, we do stick to those deadline dates. So please make sure that you adhere to those so that you can get into the program that you're most interested in. Also, again, I can't stress enough making sure that when you take those prerequisite courses that you are focused, that you have the discipline that is needed in order to get the best grades possible. A lot of times our students try to rush through it, and that can sometimes mess you up, because if you're rushing through the courses and you're just getting average grades versus taking your time and really putting forth the most effort to get the best grades possible, that is what's going to get you through the program. So make sure that you are following those guidelines. I cannot stress that enough. Make sure that you are following those deadlines. Okay? And the last program that we have is our Bachelor's of Science in Nursing. Once again, that's a transition program. A student would have to go through the Associate in Science to become a registered nurse, and then at that point, once they have their license in the state of Florida, then they can then apply to the Bachelor in Science in Nursing at that point. They can't come directly in and just start the bachelor's degree. It is a transition from RN to BSN. So make sure that you understand that. You do have to complete the RN and be a licensed registered nurse in the state of Florida in order to go through the bachelor's program here at Miami Dade College. So please make sure that you understand that. Once again, the admission requirements that I've been going through: you must have your high school diploma or equivalent, your GED. You obviously have to submit an application to the college. You must apply for financial aid. Even if you're not eligible for financial aid, you still need to apply, because that opens the door to all of our other opportunities, such as different scholarship opportunities and grants. In order to apply for any of those, you must first apply for financial aid and have it on record. So make sure that you get your information in and you submit for your financial aid. Okay? Must take required testing or equivalent scores or courses. Transfer students must submit all transcripts for evaluation. You must register for your required prerequisites and meet the required grade point average. Must meet program-specific prerequisites for program eligibility. And you must submit a separate application when you've completed all of your prerequisites in order to be accepted to any of our degree programs. So keep that in mind. There is a separate application. I have time for one more question. Let's see. We have, we have Gail coming to us, and her question is, if there's no waiting list, how do I know if I'm going to get in or not? And very good question. But once again, once you submit an application to the program, after you complete your prerequisites, you will then be notified whether you have been accepted to the program, or it will give you options on what your other choices are. You can even come in and sit with an advisor. We'll go through everything to make sure of what's happening, why didn't you get in, or congratulations, you got in. But you want to make sure that you follow up with that, but we will notify you of all acceptance to our program. So you don't have to worry about that. It all will be taken care of. Now, I want to make sure that I can't stress enough. All of these programs are wonderful, but the students, you need to have the right discipline in order to go through these programs, because they are extremely demanding. You have to make sure that you allot the proper amount of time for your studying, and also more importantly, to make sure that you allot time for clinical and laboratory rotations. We have contracts with all the hospitals in Dade County, and you want to make sure that you have the time available to go through these programs and be as effective as you can be. With that being said, I thank you for allowing me to present to you. I wish you the best of luck, and please come and visit us. And as I said, you can visit us in person or at our website, which the information is right there for you. And I hope you have a wonderful day. And remember, at Miami Dade, opportunity changes everything. Have a great day.